sexually transmitted infections, we also have to think about other infections that are not commonplace. And in our setup, TB becomes a major cause. People assume that TB is only in the lungs. TB can actually affect any body part except your hair, your teeth, and your nails. So when it is in the abdomen and in the pelvis, it can actually be an external cause that can cause inflammation and injury to the reproductive system and can actually result in tubal blockage. Then we have all the other physiological factors that can arise, where something somewhere in the manufacturing of the egg and the sperm go wrong. And this now becomes a secondary cause. So, we've had a lot of the times patients come and tell, I've been told that I have hormonal imbalance. Hormonal imbalance is not a diagnosis, and we have to figure out exactly what's happening that is causing your hormones not to be produced in adequate amounts or are being overproduced. And this is interfering with the function that is required for manufacture of the eggs or the sperm. Again, can affect both men and women equally. Some of those causes can be genetic, that you were born like that with a genetic defect that makes it impossible for this process to be completed. Others can be now acquired. So throughout life, you have problems. And we have to remember that reproductive hormones are not just centered in the reproductive system. They're actually under control from the brain, from the pituitary gland, which is nested in the brain. So if you have any issue that is affecting the function of the pituitary gland, then we know it's going to have a ripple effect. And this is going to affect the testosterone, the testosterone production and the process of production of sperm in the male. When we talk about the female, the same again. Then at ovarian level, it becomes impossible for the process of maturation of the ovum to be completed to allow for one to make healthy eggs that ovulate and are capable of being fertilized. So searching for the cause of infertility becomes the primary reason to be able to have a proper diagnosis. Therefore, you can determine treatment. But we also have to consider other conditions that may not be infectious. We have conditions like endometriosis, which is really a condition that affects women, and it takes a while before then it affects fertility. Reasons why then early diagnosis and early treatment or early interventions become critical for these patients, because the continuous inflammation that goes on in the pelvis within the pelvic organs can actually interfere with the function of the ovary physically or physiologically, and also cause a lot of scar formation within the pelvis, which can distort the pelvic organs, including the fallopian tubes, and cause physical blockage. So yeah, these are some of the causes that can lead to infertility.
Thank you, Dr. Nelly. Kendi, I know you're working a lot with families and also couples who have had some of these struggles as far as infertility is concerned. But, could you maybe paint a picture for us what it looks like, especially with the couples that you've been able to work with as far as issues of infertility is concerned?
Hi, everybody. I'm so happy to be here. I think the other speakers have done such a fantastic job. And so let me just jump in right away as a therapist. Yes, indeed, I have worked with couples that are having challenges conceiving, and I can tell you it is a painful experience. It's almost like they're grieving. Every month they have to grieve. They have to grieve the idea that they would have conceived. So some of the things we see a lot in therapy is they come in complaining that the marriage is straining, that their relationship is straining, that they used to talk about it, now they can't talk about it anymore. That the relationship was accepted in the society, now it's not being accepted anymore. So some of the things couples that go through infertility go through is exclusion, because in our part of the world, in Africa, having children is a progression of the lineage. Like when you get married, the first thing you'll hear during the wedding is, or among the things you'll hear is, oh, well done, we are so happy for you, we can't wait to see the children, you people are already lining up to be named, and so there's already a burden on the couple to have children. And I don't know about you guys, but when I was growing up, they used to be told, if you play with boys, you're gonna get pregnant. That was all the sex education we had. I'm sure Dr. Nelly would have a lot to say about that. But growing up, we were always told as girls, don't play with boys, you'll get pregnant. And girls and boys will be told, don't play with girls, you'll get them pregnant. So we grew up with this assumption that is so automatic, this thing is just jump into bed and jump out and you're just going to get pregnant. And so you carry that at the back of your mind all these years, that it is automatic, it's default, it's going to happen. And then you get into marriage where now everybody is cheering and saying, yes, let's have this baby. And then you cannot conceive. So there's a huge cognitive dissonance that happens in your head, like, what? Who? Me? What are you talking about? How can I not be getting pregnant? And of course, the first thing that happens is the self blame and the self guilt. Like, what am I doing wrong? What is wrong with my body? And many times, I'm sure the gynecologists will tell us, the women are the first ones to take responsibility. They start checking that, am I ovulating? Am I counting the days right? Women will even tell you some positions, sexual positions are more viable than others. So we find a lot of fast self blame. It's my fault, it's my responsibility, maybe I'm stressed, maybe I'm heavy, I need to lose weight. So there's first the self-hate, self-blame, the shock, the trauma, and then after that the second level conversation of your mothers and your aunties now asking you, and by the way, when is this happening? Or if you gain some weight, they're like, oh, congratulations, there's a baby on the way. So this journey of people, first you expecting to be pregnant, moves from you, then to others, and then even to strangers. Yeah. I was at a dinner recently, and my husband and I left the dinner and came home, and we all discovered there's one particular lady, we didn't ask whether she has a family or not. And why? It's because we become conscious that not everybody has children. Okay, not everybody is able to conceive, but that's a journey that takes a while to get there, for the society to become conscious that not everybody has children. But what I'm trying to say is the journey from thinking you can be pregnant automatically, to finding out you cannot be pregnant, to having to explain to your first family that you're not getting pregnant, to also dealing with the society that thinks you should be pregnant, is a long, treacherous, painful journey that I'm sure we'll get into a lot as we keep going. I don't know if I've answered your question, Leah.
Thank you, Kendi. That's a really, good feedback from you. I mean, just being able to see, to understand, the situation as it is. I know one of the things you've mentioned there is just the expectations from society. Everybody here is, okay, Kendi's now married. Kendi, when are you getting a child? There's that pressure. And like we've talked about, so far, sometimes there's that issue of infertility. And as we just move further into this discussion, Dr. Keegan, listening to what Kendi is saying, sometimes, a woman will look and say, is it my fault? Am I to blame for this? What kind of experiences have you encountered, Dr. Keegan, with some of these couples who do some bit of blaming on either parties? And what do you tell them?
Thank you for Kendi for taking us through that. Normally, this is actually quite a tedious process. Most and we want to blame the other one. Do in the clinic is that we want to have both of them come in, as we discussed infertility. But unfortunately, most of the time, the first person to come is actually the lady, and maybe the problem may not be with the lady. But as what we always do is that we start with the person who has come first. If they can come as a couple, the better for us. But normally there will be blame on one side or the other. So what we do is that when you come, we want to actually find out if really there is infertility. So we go through a good history, basically from both sides. We want to start with the lady and see her history, her menstrual history, her menarche history, her growth history, then a full examination, to make sure that everything is in place. So as you were saying, some of them are developmental, so you want to make sure that she's a full woman, the breasts are grown, and all that. So once you've gotten the full examination and the history, are they having regular intercourse, the sexual history, then we go into now tests for both the man and the lady. The tests we shall discuss later, but the main thing is just to get the history and tell them that most of these things that actually there's a treatment. Most of them can be treated if all is fine. That's what we actually try and do with both couples. But as Africans, after a year or so, everybody's asking, where is the child? Where is the child? So that tension brings it up. So we almost try as doctors to try and bring them down and try and explain to them that it's actually something that can be treated. It's a normal, it's just a disease like any other disease. And it's part of part of the reproductive health rights.
All right.
Thank
Thank
you.
you, Dr. Keegan.
Mm.
I just want to pose there a question to you, Dr. Keegan. When we talk about men, because there's that idea and notion perhaps that infertility only affects women, and that's perhaps what many people think. It's just a women's issue. But really, why is it that also infertility comes to affect men? Really, what happens to the men's bodies, or is it an issue of sperms, or just the health of the sperms? Maybe you can help us understand further, so that it's also very clear to others that it's really not someone's fault. It's perhaps maybe a medical condition.
Yeah, actually, you are talking in terms of the male. The sperms are actually produced within the testes, and then during ejaculation, we look at the sperm and see if there's actually the ejaculate, and see if there's actually the sperms are of good quality. We look at the semen. The semen has a mixture of different kind of fluids. It has a mixture of fluids from just both the sperm themselves. We have a mixture of fluids from the prostate and from the seminal vesicles. So what we want to do is look at the quality. There are many things that can affect the production of the quality. As Nelly had said earlier, the production is a hormonal process. At the end of the day, you must have testosterone to produce the sperm. So we check on that level and see if the testosterone has been disturbed. Second, we now come and look at the testes. Are the testes really producing anything? Or is producing zero? Or is there a process whereby from the testes is not able to come out into the ejaculate or have quality sperms? So it's just a matter of you having an ejaculate or a semen. It's a quality of the sperms. We want to see how many are of good quality that can actually impregnate somebody. So there are many issues that can actually interfere with this. We have talked about infections, things like mumps, STIs. There are many things that actually interfere with the production of the male, the sperm. So what we need to do is actually get the man and do a proper examination, just as I've mentioned about the lady. But most men say, since I am able to perform in bed, I'm assuming that I should be able to get a child. But that's not the case. We want quality sperms for you to be able to get somebody impregnated. Thank you.
Thank you, Dr. Keegan. It's interesting what you've just said, because that answers one of the myths that you hear most times. That, I mean, if a man is able to perform or make a woman, get an orgasm, then how is it possible that this man is also not able to get her pregnant? Dr. Nelly, I know you really work with women as also men, but I know you're very much an advocate for, especially when it comes to the reproductive, functions of women. And just to help us understand, because at least Dr. Keegan has helped us understand, especially for the part of the men, what really happens, Dr. Nelly, when it comes to the woman, that a woman is really not able to conceive or get pregnant?
Oh, thank you, Leah. I think you would be surprised how complex the female reproductive system is. And despite everything we know, we still don't know everything. The interesting part about women is that women don't make any more ova after they're born. You come with all the ova in life you're ever going to have. And we usually say by the time a fetus is 20 weeks in the mother's womb, they have the most ova they are ever going to have, which is about 7 million. By the time this baby is being born as a newborn, you've wasted over 5 million of those, and mostly because they may have a lot of defects, and you're born into this world with 2 million. They don't stop dying. By the time we get to adolescence and we start having our first period, you have a measly 300 to 400,000 left. And this is what's going to determine your entire reproductive cycle. 400,000. Now, at every cycle, when you're ovulating, yes, we ovulate one egg, and the occasional twins or triplets may ovulate 2, 3, 4 eggs. But usually you recruit about 15 to 20 eggs with every cycle to try and mature for you to be able to just ovulate one egg. So you can see how, whether you like it or not, your reproductive lifespan is already guided. And this is why we'll probably have a reproductive lifespan of about 32 to 40 years of being able to to ovulate eggs. That process is very, very complex. You come in with your eggs. When we reach puberty, our hormones are kick-started, and now we can be able to start having menses and be able to ovulate. That egg goes through a process because it's been dormant for all these years. And so when it's its turn to be ovulated, it's actually going to be triggered to start maturing. It's a very delicate balance of a lot of hormones that must actually rise and fall at a very specific pace, reaching very specific levels at specific times for that to sync well enough to allow this egg to go through the process of maturation within a time span of about 7 to 20 days and be able to mature. Once this egg has matured, then it is ovulated. Now, what we don't realize is that from the point that egg is released from the ovary to the point where this egg is actually, it only has about 12 to 18 hours to stay alive. And this is how many fertile couples don't always get pregnant on the first try. Because you can imagine in this Nairobi we live, if you wake up in the morning today and you leave your house at 6 a.m. to beat the traffic to the office, and that's when you have ovulated, chances are by the time you get home in the evening, you have already lost your egg and there's no conception that's going to occur. So you can imagine that complex process. So anytime we have a problem in any of these hormones that's going to interfere with this process, this is how you will probably have dormant eggs lying there, but they're unable to mature to reach a point where they're eligible for ovulation and fertilization. What can affect this? Issues that affect this hormonal balance. And we have to consider everything, looking at even as simple as lifestyle. We do know that women with obesity do struggle to conceive. This is why one of the things we encourage is weight loss and physical fitness to help your hormones align as best as possible. The second thing is that when we talk about hormones, people only pay attention to reproductive hormones. What we don't realize is that all the other hormones in the body serving different functions must also work in unison with the reproductive system hormones for them to be effective. So once you have a problem in one of the others, even if they're not directly related to the reproductive system, you're going to have trouble. Things like thyroid, and that's why when a woman is being screened for fertility issues, we have to check how is their thyroid functioning, what are the thyroid hormone levels. Prolactin, because these are hormones where once they are askew, they're actually going to interfere with how the reproductive hormones function, and they can actually be a cause of infertility. Alongside what we talked about genetic issues, there are people who can ovulate, but the eggs they're ovulating are incapable, even after they get ovulated, to lead to the development of a normal viable fetus. And so for these patients, they will struggle and they may even conceive, but then they are likely to have recurrent miscarriages because the baby that is conceived is incapable of life because of the malformations that will arise out of the genetic abnormalities. So nature, as always, will try and do away with what is not viable. So a lot of people walking around may think that they're not conceiving because they're infertile because they're not conceiving. Sometimes they may actually be conceiving, so technically they're not infertile, but they're not able to make a baby who is capable of developing fully to a full human being who can be born. Alongside that, you have proper generation of the egg. So what happens if it has happened? Then this egg must also be ovulated. Remember, we are talking about a 12 to 18-hour window. This egg must travel from the ovary. It has to travel through the fallopian tube. Midway through the fallopian tube, it has to meet with the sperm in that space. Fertilization occurs in our tubes. So if the tubes are damaged for any reason and interferes with this process, you can understand how it doesn't matter how many healthy eggs you're going to ovulate, there is no passage. And this is one of the reasons why then they would end up unable to conceive. These issues of the passage are the ones that we've been describing, brought about by infections, endometriosis, Then we do have patients who have undergone procedures that can actually interfere with the process of ovulation. Cancer survivors who have had to undergo radiotherapy, chemotherapy, it may actually interfere with the ovum, and they may not be able to ovulate thereafter. patients who have had destructive illnesses like TB that can actually destroy the ovary to begin with. So those then will have a physical reason why you've messed up with the factory, and obviously if you bomb the factory, it's not going to be able to work. So these are, these are some of the many reasons that can actually result in infertility. We are also beginning to very commonly now diagnose polycystic ovarian syndrome, which is one of the conditions that are a bit poorly understood, though there's a lot of research ongoing, where you have a total hormonal imbalance that results in inability for the process of maturation and ovulation of the egg to happen. And not only is it centered in the reproductive system, it also has a widespread effect, especially on blood sugar control, on obesity for these women. So that is also one of the reasons why women may actually struggle with fertility, and therefore correct diagnosis is needed before proper intervention can be instituted. Thanks,
Thank you,
Leah.
Dr. Nelly. I'd love us to also look at myths, because there's so many myths out there that inform people's perception about infertility. I just want to also the conversation to our listeners who are with us today. If you have a question for Dr. Nelly, Dr. Kigan, and also our therapy specialist here, Kendi Ashitiva, just send them through, or you can just ask to speak and we'll allow you to speak and just ask any question that you would have for the specialists we have today. This is a very big conversation, I must say. And again, I just say that I've opened up the conversation for anyone who has any question or anything you'd like to get clarity about, especially the myths that we're going to be looking at. Kendi, you working with families and couples who have dealt with issues of infertility. I know one of the myths that goes around is that, some people say if you already have a child, you don't have to worry about infertility. But Kendi, you having worked with couples, have you come across couples who already have a child, but perhaps they have had an issue of infertility?
Claire, you're breaking for me. Was that question for me, directed at me?
It was for you. Let me just pose that question again. So what I'm saying is,
Yes.
there are many myths that are centered around infertility. And given that I know you work with couples and also just basically families as a therapist, one of the myths that goes around is that if you already have a child, you don't have to worry about infertility, because that just basically means you'll definitely get a child. But have you come across couples that already have a child, but when they try to get another child, perhaps it's a bit of an issue?
Yes, I have. And as Dr. Nelly was speaking, I just realized how fertility illiterate we are as a society. She took time to take us play by play, how all of us showed up here as human beings is actually a very complex process. But when you look around and there are over 7 billion of us in this world, you imagine that it's a very easy affair, right? And so when you come across infertility, you're like, what are you talking about? But it's just a sperm and an egg. But then I think these conversations are very important. And I'm so glad that Dr. Nelly and Dr. Keegan are here just to remind us how complicated a process it is, and how there are very many moving parts, and that these moving parts have to work perfectly for you to conceive and carry to full term. And I say that because myths are always built on the back of ignorance. They are built on the back of the fact that when I don't understand something, I'll just build I'll come up with an explanation for it based on my limited understanding. So then I also come across very many unfounded truths or unfounded myths. One of them is we're not able to conceive because of a religious understanding, which is God is punishing us. Now, because many of us, our cultures, our backgrounds, our socialization revolves around religion, children have been associated with a deity, have been associated with God. And so when you're not able to conceive, many people think it's a punishment from God. I just need to pray more. I need to go and seek prayer from this special pastor or this special religious leader or whatever it is. So there's, of course, I'm finding a lot of that, people believing that this is a curse from God. It is a punishment. That's why we're not able to conceive. And sometimes I find that people that take that route in my line of work don't lean towards the area of medical science. All right. And I'm always trying to tell them, you don't have to take one over the other. You're still a human being and you have a physical experience. So because of not understanding the physical aspects of children coming to this world, and leaning only on religion and spirituality, I find more people saying, no, this is a God thing. If I don't need doctors, doctors do not create. I just need to work with God, and God will give me a child. So that's one of the myths I have come across. The second one is I'm also being punished because I had an abortion. Um, abortions are carried out a lot in our culture, in our society, in the day we live in today. So many women will quietly whisper to me if the husband has stepped out in this of the session, or she will come alone and tell me, you know what, Candy, I've never told this guy the truth. When I was in campus, or when I was in college, or when I was a teenager, I procured 2 or 3 abortions. This must be the reason why I do not have children. Again, just going back to what Dr. Nelly said, I wish Dr. Nelly was in my office to just explain to them, or Dr. Keegan, how complicated conception is, and how, it's not necessarily true that because you've had an abortion, that is why you're not able to conceive. Well, the medical part of it is not my area, but I hear a lot of those people using the limited understanding they have of the concept of fertility and building a myth around it, and saying it's because God is upset with me, number one. Number two, it's because I had a child out of wedlock, now I'm being punished. Or I had a child with a married man or a married woman, now I'm being punished. Number three, it's because I had an abortion, now I'm being punished. And so maybe those are the main three I've come across. But I also want maybe our doctors to tell us if fertility is a dynamic or a static affair. Just because you've had a child once doesn't mean you can't experience infertility, because I do know there's something known as secondary infertility. Maybe the doctors can explain to us that just because you've had a child once does not mean that you cannot have challenges conceiving later. And that is what I know goes by the term secondary infertility.
Thank you,
Yeah.
Candy. I see we have someone here who'd like to contribute to the conversation. Dr. Sarthak Arbi Misra, if you can hear me, you can
Yeah,
go
I can
ahead and
hear.
make your contribution.
Yeah, yeah, I can hear. I wasn't present in the starting of the discussion, so may I know what is the core discussion topic we are talking about?
So I know my producer has placed you because you requested to speak, but the conversation today is basically about infertility, the myths around it, the causes of infertility, and just the diagnosis about it and treatment. And so far, we've just been looking at the myths and the workings of the reproductive organs in a woman's body, as also how infertility becomes a problem in a man's body. So if you may have perhaps a contribution you'd like to make to this discussion, you can go ahead.
Yeah, sure. I'll talk about male infertility part, the cause, the medical part. See, the first thing which we do with male infertility is because there are various causes at in this decade of in this century. The thing is, we have our surrounding changing. We have stress. We have pollution. We are wearing different kind of clothes. We are eating different kind of things, and they're all contributing towards our health, degrading of our health. They're all contributing towards our degrading of the health. So these things can be changed at the level of individual level only. We just cannot change the surrounding, or we cannot change the eating pattern or the habit what they are doing or what they are not. We can only help them by educating them and different things. So there are different causes of male infertility, we have on the different level. We have like there is a process known as spermatogenesis. I'm just not going to go into core medical part, because most of them will not understand these things. But again, the thing comes ki we at that level, ki the first thing which infertility comes, we all know that it is according to the medical science, 50% of cause is due. 50% agar if the couple is infertile, 50% time it is due to female, 40% time it is male, and 10% time it is not known, it is unknown cause. But in our society, what happens if a couple is infertile, we just go all together blaming the women. This is I'm talking about the rural part of this world and rural part of India. Mainly, I'm from India, so I'll talk about the situation here. We blame the women part more, because we all know, being a doctor, and I can see you are also someone is Dr. Nell. Dr. Nelly is obs and gynae, we know ki the in infertility, whenever infertility couple come, we go for the semen analysis. But the myth which surrounds us, ki we blame the women. That is the main cause of concern. We will agree with this thing that this happens around the world.
All right. Those are great comments there. Thank you so much for just making that addition, especially for men, because Dr. Sarathak, as you say, the assumption usually in issues of infertility where couples are not able to get pregnant, and in this case, of course, the woman, the idea is the first blame goes to the woman. The woman is the problem, but like you've said, this is also a man's issue. Thank you so much for your contribution. I see Dr. Kireki is with us. Dr. Kireki, if you're able to hear me, what you need to do is click on the icon there that looks like a small microphone. And when you tap on it, rather, or with your finger, you'll be able to just request. If you can just request to speak, that would be great. And as we wait for Dr. Kireki to get with us, we'll just move on. I see there's a gentleman there by the name Neuroboy. That I think he goes by the name Amita Veen. I'll just allow my producer there to just allow you to speak so that we can hear what you have to say. But I just want to go on to Dr. Nelly. One of the things that I think I'd like to especially bring out is not just also the workings of the body, which is so important, but it's also to understand the myths, because as you listen to the doctor who's just spoken right now, he says this is not just an issue in some of the African countries, but it's also an issue in India. It's an issue that's blamed on the women. But what I'd like to hear from you, some couples, perhaps they've been told, and the assumption, even when you look at some of the write-ups out there, is they're told you need to try harder or more. You guys are not trying hard enough to get the baby. So, I mean, when you say you're not trying hard enough to get the baby, does it mean we need to have some intercourse at midnight? Is the perfect hour, or what does it mean? You can go ahead and just tell us a little bit more about that, Dr. Nelly.
Well, I think all my colleagues here will tell you one thing is that the moment you say try harder is when you're never getting pregnant. So the way infertility works, I remember we had a long conversation about the effect of hormones and the fact that how our bodies are greatly affect our hormones. So physical stressors to the body, long-standing illness, extreme sport that makes you lose so much weight. You've seen for instance, our own domestic athletes we have here. When they're out there doing their marathons, they're very tiny and very lean. That actually does affect how their hormones work. Mental stress actually does impact on fertility. Why? Because you mess up all these hormones, you pump up your stress hormones, they interfere with how the rest of the body works, and this actually makes it even harder to conceive. You will actually hear from Dr. Kireki. He gave us a very good example recently that he's had patients who have struggled to get pregnant. And when they've all given up and they have gone to him for assisted reproductive technologies, have had IVF and they've delivered the first baby. And because they're happily sitting at home knowing that I am infertile, I can get pregnant, I don't need a contraceptive, then boom, we're pregnant. Because you've stopped stressing about getting pregnant, you already have a baby in your arms and you move along. Happened to a friend of mine. They struggled to get pregnant for so long, gave up, adopted babies, and 8 months later, here they are. They're pregnant. They're having their own baby after 9 years of not being able to conceive. So there's nothing as counterproductive as try harder. That's probably the last thing you want to tell anybody. And one of the things I advise couples and start getting worried about being infertile, and they haven't really justified why they're even saying that, the first thing I tell them is that please go home and make love and enjoy making love. Forget about trying to conceive. If conception happens along the way, it will be a plus. And a lot more of the time is that when we tell people to try harder, first of all, the joy of making love goes out of the relationship and it becomes a chore. and it becomes about timings, and it becomes about counting days. Nothing is more stressful than those little calendars women have, the period apps. Today, I'm ovulating. Where are you? You have to come home now, 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 now. It can be very, very, very counterproductive. And it's what we keep seeing over and over and over again. When we have men who think that an ejaculate is equivalent to fertility, that's myth number one. I think men need to understand what makes up the fluid part comes from the seminal vesicles and the prostate gland. It is purely, it's nourishment for your sperms. So you can make sperm, but these sperm are blocked and they're unable to come out. It doesn't mean that you will not ejaculate. You will. Lots of it. But it will not have a single sperm in it. It still renders you infertile. And remember that being virile, having stamina, doesn't equate to fertility too. That's another thing we've had. And we have actually seen people say, there's no way that old man could have been the father of that baby. He's too old to even consider making love. Those old men will surprise you, because it's not about how long you last, how frequently you ejaculate. If that day the egg was ready, the sperm will actually make you pregnant. So those are some of the myths we encounter. We've also had, I think one that Candy spoke about, that talking about abortions, and people thinking that, okay, so now I'm not conceiving, because one of the greatest fears that has been ingrained again in the young people is that if you have an abortion, then you're going to be infertile. Again, I need us to remember that even spontaneous miscarriages are abortions. And people can actually miscarry 7 times and still get pregnant. And we actually don't have these conversations enough, because rarely do people report miscarriages. Why? Because of the stigma surrounding abortion. Just about a month ago, there was a huge storm on the same Twitter about women being very upset about miscarriages being called abortions and not liking the term at all. So you can imagine the impact of the stigma against the term, and the connotations that it will carry, then make it very easy to carry along this misconception, or that if you've had an abortion, that you will not be able to get pregnant. That's not correct. If you had an unsafe abortion that resulted in complications or infection, this can block your tubes, this can destroy the lining of your uterus, and this may actually result in infertility. So we have to be very specific about what exactly it is that leads to that. And I think one other thing that we've had is how men really struggle to accept a diagnosis of infertility or subfertility. They are the ones who are likely to walk out of the relationship when you tell them that they are the ones who have a problem. And this is part of the problem when the woman comes to the clinic alone, because then you've tested her, you've checked her up and down, and everything looks good to go. And then you say, I want to see your partner, even if he's totally being stubborn. Their most partners won't even come to clinic. Sometimes we have to send the test request form and say, tell him then, even if he doesn't want to come, to at least go and do the test, because we are not poking you and prodding you anymore when there is no justification for it, and we don't know how the other 50% responsible for this pregnancy is doing. And they go and they do a simple semi-analysis, and you find that the problem lies with the man. Now the struggle becomes, how do we tell him? We had this challenge when we started doing HIV testing for mothers in the clinic. You test her, she's positive, and now she says, how do I tell my husband? And what did? We introduced couple testing and say, come together, let's test you together, so that one doesn't have to go and relay the results to the other party. And the same thing applies to fertility, that the men need to actually get a lot more involved when babies are not coming. They also need to start from a perspective, very objective perspective, that there is a huge possibility, 40% possibility, that I too could be the reason why we are not getting pregnant. And I think we will hear from our colleagues on the various treatment options that exist. It is not always all lost. There are a few patients we have to honestly tell them, this is not going to happen. And this is where assisted reproductive technologies came up, on how then do we make people at least be able to achieve their dream of being parents. But yeah, there are very many myths, and they are really being very retrogressive. And the reason why Kendi has a job, because it's a huge impact on psychology, it's a huge impact on families, and we have to be a lot more outspoken about it for people to learn to be a bit more open-minded when it comes to issues of infertility.
Wow,
Can
fantastic.
I say
Yeah,
something?
can
Can
I
I say
piggyback on
something?
that? Oops. Hello.
It's okay. Let me just then allow you, Candy, to go ahead because I know there's something you need to reply there. Dr.
Yes.
Kirek, I want to come back to you.
Yeah. I
Definitely
just
coming
want
back in a minute. Candy, go ahead.
I just want to piggyback on what Dr. Nelly has said. What she's described is so true. So what we see in terms of the man suspecting he could be the problem. So what happens is, like Dr. Batilol also said, the women are the first ones to go to the clinic, right? So they do their test, and we see a lot of avoidance with the man. So the man avoids, he's busy, he's traveling, anajipatia shughuli. In other words, he makes himself very busy so that he doesn't go for the test. However, he suspects he could be the problem. But what I found in therapy is what some of these men do is they go and try to get other women pregnant. So as opposed to going to see a doctor to see maybe there's something wrong with my sperm or something wrong with my body or my ability to get a woman pregnant, they try and now get very promiscuous and they attempt to get other women pregnant, sort of like validate themselves. Whew, thank God. At least it's not me, it must be her. I've seen that a couple of times, and it has ended up destroying a lot of marriages. Sometimes they try and get another woman pregnant, but she's also sleeping with someone else. So when she gets pregnant, he assumes it's his baby. I mean, it gets very, 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 very messy. Only for him to later find out that the woman he was testing himself with was also sleeping with someone else. So she got pregnant with another man's child. All along, he was hoping on that baby that is his child, so his wife is the problem. So what Dr. Nelly is talking about is so true. We find that whenever the couple is struggling to get pregnant and the man takes the path of avoidance, it's not really avoidance. It's avoidance to get medical care, but they look for solutions for their problem either by trying to get other women pregnant. Some of them go into alcoholism, some of them get into smoking, some get even abusive just to sort of silence this woman. Some of them even avoid touching their wives so that it can be, we are not getting pregnant because we're not having sex, not because something is wrong with me. I hope that comes across very clearly so that now the woman doesn't have anything to use to say that maybe it could be you. Because remember, now he's hardly there, traveling a lot, and when he's around, he doesn't want to have sex with you. So you're there thinking, but the doctor said I'm okay, but we're not having sex, so it cannot be him. It's probably circle back to me. I just thought I'd throw that in there. Some of the behavioral responses I have seen in therapy when it comes to men who suspect or think they could be the problem.
Wow, that is such an insight there, Kendi. Dr. Kireki Omano, I'm really happy to see you. I know you want to say something. If we can just introduce you briefly. Dr. Kireki is a consultant gynecologist and also fertility specialist working in the University of Nairobi. He's a trained gynecologist and has worked in London, UK, over 12 years of experience in the field of infertility. Good to see you, Dr. Kireki. Go ahead and just, give us your contribution.
Asante sana. First of all, let me thank you for inviting me here. And I can see my colleagues are here. Nelly, I can see Dr. Keegan is here. And thank you very much for bringing up this very, very sensitive, stigmatizing topic. Cuts across all the cultures that we know, and more so in our background, in our backyard here where we are. I sort of have a feeling that today we are talking about male infertility, which is a very good thing. June has always been an infertility awareness month, and we've been trying as COGS, to try and create awareness, and also this is part of it. And I've listened to Dr. Nelly, and I've listened to Kendi speak, and yes, we do have a problem with men, and it's a serious problem. Out of 10 patients who come to see me in my private practice, you may find maybe one occasionally, a gentleman who comes on his own volition. And actually some of them do go to a lot of a lot of lengths to try and find out what the problem is. Just a case in point, let me just point out one or two cases, very interesting, sometimes comical, sometimes actually sad and tragic. Several months ago, maybe about a year ago, I was working at a certain fertility clinic, and this gentleman came, and I was a bit late because I was doing something else elsewhere. So by the time I got there, the guy was agitated. Daktari, ulikuwa wapi? You know what? We have been waiting here. I said, I'm very sorry. When you don't see me here, it's because I'm also working elsewhere. Anyway, to cut a long story short, the gentleman comes. He's about 30, 33 maybe. Comes with a sperm test, which is negative, azoospermic, no sperm at all. So as I'm taking the history, I'm asking these questions, that question. I ask whether he has had children in the past. And he tells me, yes, he's married. This is actually his second relationship. In the first relationship, he had 4 children. I said, okay. I put that in the parking lot. And in the second marriage, the present wife came with a baby, and she's expectant. She's 6 months expectant. So something doesn't add up, because you are 33, 34, you have 4 children with one lady, and the second wife is pregnant, 6 months. What the hell are you asking me? Why are you coming to see me with a sperm test which is azoospermic? So I said, okay, well, maybe there could have been a problem in the lab. Please go and do another sperm test. And he went and came back with it. It was 0. There was no sperm at all. So he asked, so are there any other tests? Because even me, I'm curious now. So 2 sperm tests which are 0, and we need to find out a little bit more. So I send him for some more tests, some blood tests, and a scrotal ultrasound scan. And what comes back is that the hormone levels are very elevated, meaning that actually he does not produce sperm, and possibly he has never produced sperm even before completely. The testicles are tiny, what we call atrophic. And I explained very gently to him. I say, look, with these kind of levels, we've done 2 sperm tests. We've done a blood test, and we've done a scan. Most probably, you have never produced sperm. The guy says, no. I mean, is there any other test we can do? He said, yes. I sent him to a colleague of mine who's a urologist to do what is called a testicular biopsy. And he does a testicular biopsy, and what comes out is that there is primary arrest, meaning that sperm is not produced, has never been produced. So I break the news to him. I tell him, you know what, we have done all this array of tests, and it all points out to the fact that it seems as if you don't produce any sperm. Is there any other test that we can do? No, there's no other test that we can do. We've reached mwisho wa lami, as we say. So he asked me a very painful question. He said, but Daktari, if you say all these tests are like this, but I have 4 children with the first wife, and now this one also is pregnant. And then I asked even before that, but why exactly did you go to do this sperm test if you knew that you had children? He said, previously I was in a relationship with a lady for 2 to 3 years. And this lady came home one day and just told me, you are infertile and you can't even make anybody pregnant. So that thing sort of stuck in his subconscious, and it had been eating him all these years. So when he asked me the question, so whose are these children? I think it was very difficult for me to actually break the news to him. So I tried to find a diplomatic way of going around this. I said, when somebody is a father, you can be 2 types. You can be 2 types of a father. The first to these children. The other one is a social father, meaning you are taking care of these children, taking care of their emotional needs, their physical needs, and so on.
You had, Dr.
Yes.
Kiraki, there's a moment you had actually disappeared. Maybe you can tell us the first kind of path before you go to the next. Sorry about that.
The first kind of
The first kind
hello
of father.
the first kind of father, a genetic father, a biological father, meaning you are the one who has given the genetic material. These children have your genes. And the other one is a social father, meaning you're taking care of the emotional needs of these children, their physical needs, you are feeding them, and so on. And they're the ones, they know you as the father. So in this case, you are actually the social father, but not the genetic father. Of course, he was very disappointed. I had to organize for a counselor for him, and he went and most probably saw the counselor because I didn't see him later on. Another case, which actually I'm dealing with at the moment, a gentleman who is around the 40s, married, have been married for about 5 years, 6 years, did tests and completely negative azoospermia. Have seen some colleagues, some urologist colleagues, and they've tried to open the tubes where the sperms pass through, but still the sperm, there is no sperm. He did a he did a blood test, hormone test, and the hormone tests look okay. What he touched me, and this has actually stuck on my mind, is that he talked to his wife and said, "Look, I have allowed you to go and have intercourse. Don't let me know who that person is, such that at least we can have a baby, and then our life will continue." Now, the worst thing is that the wife started a relationship with a younger gentleman at her workplace, and then she brought him home. This guy goes home. He finds this gentleman is at home, and this is the wife. This is the one the wife is having intercourse with. Completely devastated, absolutely devastated. These are extreme cases, as it were, whereby gentlemen are trying to actually find that label of being a father. It's very painful for us men, when you're told, you know what, you don't have any sperm, and these are the options. When you start talking about the options, there is a sort of a brick wall which sort of the message doesn't cut across. But something else I've also seen is that when these guys come who are esospermic, they come with their wives. These ladies are extremely supportive and understanding, and they say it will be okay. It doesn't matter. It is you that I love, and that we are going to have this baby, and so on. However, just to underline before I stop, is that the way we have been socialized as gentlemen, as boys, even right from the beginning, when you're a little boy and you're playing football or you're running and you trip yourself and fall and you have a cut, you graze your knees or whatever it is and it's painful, when you try to cry and your mother is there or the other people are there, they tell you, don't cry. Familiar, men don't cry. You see, so we grow up with that notion that whatever is hurting us, we don't actually bring it out. We can talk about all other big things. We can talk about Manchester United and Chelsea and Arsenal and whatever it is. We can talk about the political affairs that are going on, but things which are personal to us as men, it's very difficult. Ladies will meet and they will talk with, they'll open up and talk about their periods, what is happening. They have seen Dr. X, they've gone to Dr. Y, these ones have not helped, now we have come here, and so on. And the stupid husbands who don't listen to them, etc. By the time they leave that reception area, you find they've actually become friends. It's a sort of therapy. Men cannot do that. So I think it is incumbent on us to try and encourage these men to come out. Let them come out. Let them talk. Talking about a serious problem and a sensitive and stigmatizing problem like this one does not make them less of men. It only opens up the possibilities of us to help them because the skills are there and the abilities are there. Thank you.
Wow, that's a lot of great information there, Dr. Kireki. If I can just try and quote you, that just because a man is infertile does not mean he is less of a man. That's a wonderful quote there. Candy, listening to what Dr. Kireki is saying, and I know you work with couples, and he's given quite powerful examples, especially that have to do with men, and some of them are a little shocking and sad. But Candy, what would you say to the men who are listening even at this time, and others who are listening on behalf of men whom they know perhaps are grappling with this issue? How they can be able to come out? Where do they begin towards talking about this issue of infertility? They're not able to impregnate a woman, or they're having a challenge in getting their spouses pregnant or their girlfriends. I mean, where do they begin towards getting help to speak up?
Wow, thank you so much, Dr. Those were very powerful stories. And, I'm in the business of people's stories. So that's a those two are powerful stories. I would say this to all those men. One, I am a woman. I've never been a man, even one day in my life. So I can only imagine how difficult it must be to not be able to sire a child. I can only imagine the shame that you feel, the sense of failure, the sense of guilt. Working with one man, he once told me, my boys keep telling me, try and sleep naked with your wife, just hinting, my friend, why aren't you guys having a child? Eh? Another one told me, his uncle called him and told him, kwani kazi imekushinda? Why aren't you guys having children? Kazi imekushinda. Like other men would taunt you and make such reckless statements, and they would really injure their ego and their self-esteem and their self-worth. And there's something about not having children that cannot be medicated by other forms of success. Let me just be open and honest here. I've worked with people who are very successful in the corporate world and they're doing very well, but then that success is not able to medicate the pain of not having a child of your own. you know and I've had a man tell me, Candy, I would leave this job any day to just have a son and a daughter of my own. I would give up all these holidays. I would give up all these things. I just really, really just want to be a dad, you know? So what am I doing? I'm just acknowledging that pain that you feel is real. That desire for progeny is real. It's natural. It's powerful. I would say the shame that you're feeling is real. I would say find one man you can trust. I don't think it has to be everybody's business. I know we're in a very sharing society and a very sharing culture, but what I do tell clients is you don't owe the entire world an explanation. You don't owe everybody an explanation. Not everybody can be your support group. Yeah. So find at least one man you can be vulnerable with, that you can tell. That man can be your peer, that man can be your senior, that man can be your religious leader, that man can be a professional colleague that you have a bond with, an emotional bond with, because what you do need in this season is an emotional connection, emotional support, even as you journey through this. I find that men that struggle to sire children also start experiencing low libido. Their desire to even have sex goes through the window because they're saying, for what? To what end? You know? So like I think what Dr. Nelly was saying earlier, trying to jumpstart this couple to continue having sex for the sake of their relationship becomes some of the work that I do in therapy with clients. Now saying, okay, are we able to put this desire for a child on hold and just work on their relationship? Because sometimes you will find that other things in the marriage are working, but this one big thing is not working. And I tell them, and while we're still praying, while you're still believing, while you're still seeking medical intervention, is it possible to find a way of still enjoying the relationship? And it's not as easy as we imagine, because these couples really, really, really want to have a child. And so they try and find a way of, powering through this desire, but it's not easy. What I do say is find someone you can talk to, find someone you can be vulnerable with. If you can get a couple to be vulnerable with, that would be a very good thing. I know in Kenya there's a group called, it's a trust called the Waiting Wombs Trust, and they do videos. I know there are two couples there that do videos, and so the men share their story, the women share their story, and it's so important to find that community where your struggle can be seen, your struggle can be acknowledged. You can find a place where you are normal, because everywhere else you feel abnormal, you feel, like you're not enough. And that is just how you feel, and it's a real feeling. I don't like to help my clients pretend that they're not feeling a feeling that's there. No, if it's there, it's there. So find a place that this feeling can be seen, acknowledged, and supported in this season that you're in. The other thing I tell them is, this season may not be your forever. Okay, to mean that just because we're here doesn't mean that we give up hope. It may not be your forever, but this is where you are today. So today, find someone that you can talk to, especially one that you can get one that understands that journey even better. If not, just get someone that can cover you, hold your hand, and just support you in that season. And find someone you can open up that vulnerability to. That I guarantee you is a very, very good thing. Yeah.
Thank you so much, Candy, for that. I want to go to Dr. Keegan, and also just want to invite our listeners, those who are listening to our conversation today. I'm so happy that you're here, and we do hope that this conversation will be helpful to you and also to your loved ones who also need this information. The floor is open for anyone who may have a question. Maybe you want to make a comment, or you want to ask the specialist a question on how to go about issues of infertility, maybe for yourself or someone. Go ahead, the floor is open to you. But as we move on, Dr. Keegan, one of the things I think I want us also to establish is, yes, there's this issue of infertility, but is there treatment for issues of infertility? And even before we go to treatment, I'll give an example of a lady I know personally. They tried to get a child for almost, 7 years. I think it's actually 6 years. On the 7th year, they actually got a baby. But when I spoke to her, and I was actually trying to get her to come on and share her story, and maybe she was not too ready, because for her, she says the issue was not infertility, that they were unable to get a child because of other reasons, but not necessarily infertility. So, Dr. Keegan, maybe you can give us an answer to that one question first before we go into treatment. Is it possible for couples not to be able to get a child, and this not because of necessarily infertility?
Thank you, Leah. And maybe just before I go to that question, I want to go back to what my friend Kireki said, my colleague. Men issues actually have been there from time immemorial. If you look at many cultures within our country, you find that people somehow the men had a way of talking. And they would talk and would come up with solutions. They may not have been scientific, but they did have solutions. You would hear that this fellow was not able to conceive, but his brother helped him in conceiving. So there were ways whereby the cultural ways people would talk. But now in this modern world with modern medicine, we don't seem to be able to get people to talk to us as men. So you sit with your problem and actually go down the drain with your problem. You go into depression, you go into many sorts of things. So I think we need to find how to get men to talk to each other.
Dr.
Fertility.
Keegan,
Sorry about that.
sorry,
In
you
terms
had gone away for a minute. Maybe you can just repeat what you were saying, please.
I was saying in the olden days, the men would sit down and be able to sit and talk to themselves. But nowadays, with this modern world, we don't seem to be able to have forums where people can talk. So the men nowadays with infertility, they go down the drain, they go into depression, they go into just go down the drain. So we need to get forums where we can help men to be able to discuss these issues, because really getting a child for a man is a big issue. In terms of infertility, as Nelly had said earlier, you may not have a problem as such. You find that we check on the man, the semen is okay. You check on the lady, the eggs are fine, the tubes are okay, the uterus is fine, but they're not able to conceive. But that is because of those pressures that we have in life. You remember you were told that the fertile period is about 12 to 18 hours. We find people nowadays in life, somebody staying in a different town. By the time they are meeting, there's no ovulation. Secondly, just the life of Nairobi, the life of stress, the stress of the cities, the stress of the shags. Somebody's not able to, but once the mind is rested and they're comfortable, then you are able to conceive. I have followed couples and we put them on treatment and we find they're not conceiving, but you tell them now, take a holiday, let's take a power break, let's forget about thinking about infertility. The next thing they come back to you is that they're fertile. We've had couples who a man has been trying to conceive, both of them, but they're not able to conceive. So he tries gets a second wife. The second wife gets pregnant, and immediately after that, the first wife gets another 2, 3 children following each other. So really, the mind really has to be set so that you can be able to get that kind of fertility. Thank you.
Wow, fantastic, Dr. Keegan there. Thank you. I see we have a contributor there going by the name Lady B. If you can hear me, you can go ahead and make your contribution.
Right. Oh, thank you. So I have two questions. So the first one is, I have a friend who was married for just over 15 years, and she couldn't conceive, and yet her husband had a child from a previous relationship. Um, Unfortunately, that marriage ended, and she got together with somebody else, a second husband, and she conceived within 3 months of meeting him. So I just wanted to find out, like, what happens in cases like that, because even for her it was a shocker. She did say that she'd always had light periods throughout her life. They were so light that she didn't actually need to use a pad. Tissue, whatever was enough for her. So that's one. And then another question is from, I think, that the doctors, like, from your experience, if couples are dating, like, pre-marriage, do you advise that they check for fertility, or leave it until they're married? Thank you.
Thank you so much for that contribution. I don't know who would like to answer that question. Dr. Nelly, Dr. Kigan, Dr. Kireki, who would like to go ahead if you feel very confident to answer? Perhaps the first question. Dr. Nelly, let me go with you. I don't know
I'll
if
go with
Dr.
the first question.
All right, Dr. Kigan, go ahead.
I'll go with the first question. You see, what happens is that some people say that they had actually, the first history we ask the man is if he has had a child before. And most of them will tell you they've had a child. But remember, the owner of the child, the one who knows who the child father is a lady. So sometimes the man may be infertile, but he thinks he has a child. Second, we have what you had asked earlier about secondary infertility. You may be fine and get a first child, but both man or women can actually get what you call secondary infertility, whereby something else affects you and either your sperm becomes of poor quality or basically the lady cannot be able to conceive. Those are things that we have to look at before we make that decision.
All right, thank you so much,
Um,
Dr. Kigan.
Maybe if I could chip in.
Okay, go ahead, Dr. Nelly.
I think as we were discussing causes of infertility, you do remember we did talk about a 20% where the possibility of infertility could actually arise from both couples. And in medical terms, we actually refer to that as subfertility. That you may have somebody who's not necessarily completely infertile, but because of certain factors, they don't quite hit the peak of fertility. And so if their partner is also experiencing similar challenges, may not necessarily be fully infertile, is just maybe struggling along with a few things here and there, together it becomes a lot more difficult for them to be able to conceive. But the minute they split and they meet other partners, the partners who don't have a subfertility issue, then it becomes possible for them to actually go on and have children. Also, you have to remember what Kendi is trying to tell us over and over and over again, that when infertility strikes or subfertility strikes, there can be quite a lot of pressure, and the pressure can actually lead to a lot of stress. So the environment between the two as a couple can become so toxic that it actually becomes impossible to conceive. And so the minute they split, they're starting new relationships. There is no pressure to try and get pregnant. You're not thinking about it. The mind is relaxed, the body is relaxed, and bam, there we go. And we actually are able to conceive without effort. About the part for whether couples should be screened for fertility before marriage, again, now is really a personal issue, because if you profess to love someone and prior to marriage you find that you're unable to have children, or that person is unable to love children, does your love end? Does it cease to become important? It may be good for information purposes, but then you also want to be very sure about what you intend to do with that information. we do know that there are certain conditions that we encourage, medical conditions that we encourage couples to do prior testing. And in Africa, one of the commonest ones that we're advocating for now is sickle cell disease. It does not mean that if you have you're a sickle cell carrier and you meet a sickle cell carrier that you can't get married, but the information is out there. You know what the odds are of having a child with sickle cell. You know what options you have, maybe to be able to avoid having a child with sickle cell. So it then makes sense why you want to do that screening. When it comes to HIV, couples want to know, we are getting married, we are going to be having sex, so what's happening? Or we already are having sex, can we be sure where we're starting from? You'd be surprised from the experience we have as gynecologists. Even as stigmatized as HIV was, you can bet that couples being discordant was never a deterrent to them agreeing to get married. So when it comes to fertility, that has not been explored. Remember also that infertility is not a static issue. We are hearing about secondary infertility, which is also something that a lot of people don't quite get. So you can be tested today, and you're both whatever tests are done, you're fertile, and you can actually conceive. What happens when you one of you maybe develops secondary infertility? One other issue that we didn't raise about infertility is that you can actually have couples who are both perfectly fine. Unfortunately, you find that the woman's immune system is a problem when it sees the man's sperm. It literally recognizes the man's sperm as foreign and attacks it and destroys the sperm. So despite the man being fertile and able to have a good sperm count, healthy sperm that can impregnate a woman, the woman being fertile and able to receive a sperm and be able to actually get pregnant, this little issue here becomes a challenge. So now we have technologies that can assist such couples, but for couples who may not have been able to come down to that diagnosis, then you can understand how they can live together all these years, perfectly healthy people. They are unable to conceive as a couple, but the minute they meet other partners and the situation is not the same, then they are both able to conceive separately. So it's a very, it's one of those topics that it's not fully medical, it's also highly social, and we always have to consider what's the social impact of this. If a couple is going into marriage for purposes of having children, we're getting married, we're going to have 7 children and we're going to raise them. Obviously, you can see why you want to start from ground zero. Before we make this commitment, are we going to have children? But there's a whole lot more to marriage. And so you have to think about it. So if we are declared unable to conceive, are we saying then that we have no business getting married? I think when you think about what the impact that has on your decision, then it is something worth considering. I think I'll hand that back, Leah.
Thank you so much, Dr. Nelly. I see we have, I did see, and I'll just allow, I see there are a few people who'd like to make a contribution. Lady B, I saw you had perhaps a comment towards, I think what not Dr. but Kendi Ashitiva said earlier. If you still have that question, maybe you can pose it now before we move on, Lady B.
No. I'm satisfied with all the answers I got. Thank you very much.
Right. Thank you so much. Mr. Jackson, someone goes by the name Mr. Jackson. You can go ahead and speak. I don't know if you can hear me. The account goes Mr. Jackson, I think JC327, as I see the account goes by that name. Probably as we wait for one of the listeners there, Mr. Jackson, to speak, we can go over to, I see another speaker here, Hannah Ali. You'd like to make a contribution to today's conversation. I don't know. Well, let's just give Hannah some time to get on, but just going now into treatment. I know we've talked about, infertility, what it is, who it affects. We've established infertility is not just a women's issue, it's a man's issue as well. And I'm really, really happy to have had the kind of panel we have tonight. And of course, just the contribution from the speakers, from the listeners as well. I see Hannah Ali would like to speak. If I can just ask my producer to make her speaker, but Hannah, don't worry, we're working on it. I see you're able to speak now, Hannah. Fantastic.
A listener and you were saying I could contribute. Carried
Sorry
away.
about that.
Yeah, that's all right. Thank you very much. And I actually thank Dr. Nelly and all the other doctors and the contributors. Actually, I was quite interested with the last statement Dr. Nelly said, and people mostly don't look at it that way. They see two couples, they've been together for 10 years. Everybody is perfect. They've done all the tests, but they're unable to conceive. There are no external pressures. But what she said actually hit it on the nail, that the woman's body attacks that sperm and as a foreign, and that's the reason the person is unable to conceive. So many times you'll say, "Oh, how come? They get separated. Everybody has kids," and people wonder what happened. There's other issue that I would actually like the doctor to touch about two things. One is a comment and one is a question. The comment is in our society, mostly women are the ones who are put under a lot of pressure. They don't look on the men's side. It's like it's God given, they're fertile. So always you would look at, if I speak as an African, mostly they point the finger at the woman, as in what's wrong with her, why can she not conceive, can you think of getting another wife where it's permissible, or and etc etc, which is quite I find that to be quite bad, that it puts the woman under a lot of pressure, and that also might contribute to a lot of the problems. That said, I wanted to ask Dr. Nelly, somebody with whether what do we call? Sorry, with problems with the is it I'm sorry, the name is just my mind is just gone blank. Let me just come back to you.
Sorry. Sorry about that. But just stay on, Hannah, while you put your thoughts together. I know Dr. Nelly would be happy to answer your question. And thank you again for your contribution, Hannah. Just stay on and put your thoughts together, then we'll come back to you. But I just want to go to you, Dr. Nelly, and one of the things is we want to also understand, yes, there's the issue of infertility, but is there really treatment for cases of infertility in men and also women?
Thank you. I'll go on to that. There are several.
Go ahead, Dr. Keegan.
There are several treatments. As we have said, there are many causes of infertility. So treatment depends on the cause of infertility. But there are conventional treatments. You can treat the diseases as they are. If it is a hormonal problem, you try and organize the hormonal. If it's a thyroid function problem, you might try to organize that. If it has something physical in the male, you may do surgery to improve that. So there are different cases of treatment. But of late now, we have what we call assisted technologies, which starts from intrauterine insemination to IVF and other methods. We add in the assisted reproductive technologies include surrogacy and adoption as part of the treatment. So there are many treatments. It's taken case by case. So each case that we have, we take you through the options and you see which is the best option that you have. Thank you. I've just given a summary of the treatment, but there's a lot of treatment that is available.
Thank you, Dr. Keegan. Dr. Nelly, I see you have something to say.
Yeah, I just wanted to add on to that there's also a huge impact on lifestyle. And there are things that men, especially those who are experiencing subfertility, can do to improve their fertility scores. And we're looking at excessive use of alcohol, smoking, obesity, very lifestyle in terms of there is no physical fitness. and what we eat nutritionally, some of our occupations, exposure. We know that exposure to high temperatures actually does affect sperm production. There is a reason your testicles hang outside your body. It actually allows them to be at least 1 degree cooler than the core of your body temperature. That is for a reason. So the moment you actually upset that, and so we're looking at people in professions where they spend a lot of time in heat. I know we've actually had a specific study done among welders because of their exposure to high heat by nature of their work. These are things that actually they are contributors to male subfertility, and there can be a lot of improvement in just trying to avoid those and improve our scores. Currently, we are also having a lot of recreational drug use in this country, which we are taking for granted. And one of the challenges, especially now with the upcoming younger people, we're beginning to see is that there's a huge combination of recreational drug use, throw in disinhibition, which of course then leads to a lot more of alcohol consumption, probably more likely than to take up tobacco use. We know shisha is banned in this country, but it's definitely not banned in some quarters. So all of these are actually being taken seriously because they are major contributors to issues of fertility. So looking at the things we can change. And you'd be surprised that when we have couples where we're struggling with fertility issues, it's always sort of a lot easier for the women to embrace lifestyle change if it's going to improve their chances of conception as compared to the men. And this has been reiterated over and over with my colleagues who've spoken, that men will always find it a lot harder to handle issues of fertility, subfertility, and infertility. So it's just an encouragement that you got to know that there is something also that must come from you. Even for those who are going for assisted reproductive technologies, they do tell you, we need to optimize you for you to give us the best possible sperm for improving chances of conception when we are going into the procedures. So it's not just a matter of knowing, oh, now we have science, it can take care of me. I don't need to try, I don't need to do my part. The other thing that is also important in youth, and this I speak because I work with adolescents and young people a lot, is that we're in the movement of sexual liberation all over again. And you'd be surprised just how our young people sometimes, because of their sexual lifestyles, they can literally be the reason why 5-10 years down the line, they're unable to conceive. And this goes for both genders. So you will find that we're struggling with young men who, we, as much as we haven't spoken about this, you first must be able to have sex for you to make a baby. So we're having a lot of young people who are beginning to struggle with erectile dysfunction at an age when it was unheard of in the past, when they're supposed to be the peak of their virility through the 20s and the 30s, because of lifestyle, because of the kind of exposure to sex that we've had, and not understanding the psychological repercussions of that in the future. So we also have to think about women who've gone through rape and their perception of sex. And there are couples actually who will tell you, yes, we are together. And I currently am walking through with two of them who, one has, we cannot pinpoint an episode in the past that may be a challenge to why she's struggling with being able to have to engage sexually with her partner. She's not, I mean, she's somebody she's dated for a while, she loves him and she doesn't have a problem, but she just is terrified at the sexual act. The other one is somebody who is a rape survivor. And despite having gone through therapy for most of her life, it looks like her core issues have still not been addressed. And so the thought of being able to sexually interact with a man is daunting, and it's actually taken her through 3 broken relationships because she's reached the point where she has to let the relationship go because she's unable to give in to sex. Obviously, those are straightforward reasons why couples then are unable to have children. But for the young ladies, and more so ladies, have to realize that they tend to be, we do know in the risk for developing sexually transmitted infections, women will always be at a higher risk of contracting these infections, for the simple reason of physically how we are made. We are recipients, and so they're more likely to get STIs. And we have STIs that are not very uh, symptomatic. So somebody can actually have an STI for a very long time, for instance, chlamydia, and the symptoms are not very open. So they may have a discharge here and there, and then it's 2 3 days it disappears, because again after 6 weeks, another day after a month, it may persist for a while, like, oh, I'm used to seeing this teacher, it will go on its own, I don't have to do anything about it. And since it's not very painful, it's not offensive, it's not distracting her, she may actually be unaware that she's had a long standing sexually transmitted infection, which she could have picked at 21 when she had a one night stand in the club with some boy she doesn't even remember his face. And so what happens? 5 7 years down the line, she has blocked tubes. And now we're struggling with fertility issues. So we do have to actually have these very real conversations that there are things we can prevent. There are things we can improve. And so we must think about our lifestyle, both sexually and otherwise, to see how do we then interface in this space and reduce some of these issues that may arise in future. Thank you.
Thank you, Dr. Nelly. Candy, in having worked with families and couples, what would you really say as regards to what couples can do? What do you tell them when you perhaps want to advise them towards dealing with issues of infertility? You know, the psychological aspect of it, and I know the psychological aspect has been mentioned by Dr. Nelly as well. But what's your experience like, and you know, what's the reception from couples?
Thank you so much. That's such a great question. And I wish we could only, even emphasize louder and louder what Dr. Nelly is talking about in terms of how sexually, how much exploiting, how liberal young people have become, how much group sex is happening right now, how little information young people know about the long-term effects of these STIs. I cannot tell you how many times I'm in therapy with a 19, 20, 21-year-old, and they are giving me the sexual history of someone who you'd think is 50 years old. And I hope before the end of this call we can even talk about the age at which young people are beginning to have sex. People are beginning to have sex at age 11, 12, 13, 14, increasing the exposure to these STIs and STD, and even increasing the exposure to sexual trauma. And I think Dr. Nelly mentioned about sexual trauma and how it has long-term effects. And when you're young, you're not able to see that this one action can cost me a lot of money, emotions, and tears in 20 years' time, but it does. And so I'm so glad this conversation has taken that tangent, because we are dealing with what we are seeing now, but I think there's a pandemic coming in 10, 15 years that we are not even ready to see. I think in the next 10, 15 years, infertility will hit the roof because of what is being done today in the clubs, in the back of a car, in Airbnbs, in Vasha and all these things that we have happening. It's quietly growing. It's a pandemic that's quietly growing. So I'm really happy that that's come up. So couples, what do I suggest all the time? I'm back to, finding a social support group. It's a very isolating problem. Infertility is a very, very isolating problem. And like someone said earlier, the embarrassment and shame attached to it. I was talking to a friend a few weeks ago, and she said she's in a married group in her church, and there are these two couples that do not have children, and it's been 9 years and nobody has ever talked about it. Imagine that. So they're in a marriage group in their church. They've been together for almost a decade. Everyone has had kids, everyone is raising kids. There are these two couples that do not have children, and nobody has ever brought it up. So everyone just acts like it's not happening. And that you can find yourself in that situation, but I guarantee you it is bothering you, it is eating you alive. So as opposed to pretending it's not there, find someone to talk to. Let it be. Talk to someone about it. Recently we have a musician in Kenya who's called Evelyn Wanjiru, who conceived after 10 years. And and she just painted a very clear picture of how it's not just the embarrassment the couple feels, it's also what their families feel. So she said how she called her mom and told her mom, we are finally pregnant. And her mother said, oh, finally these women in the chama will stop laughing at me. Yeah. So that tells you how much shame there is attached to not being able to conceive. And this is not something we can wish away or pretend is not there. We can only offer support. We can only offer support. And I say this not just to individuals, but also to institutions, you know. I say this to churches and church leaders, to social groups. Make this a normal conversation. Make this the kind of conversation that makes people that are struggling feel that we may not raise our hand and say, oh, yeah, we are struggling to conceive in a social gathering, but let it be known that this is a common problem and it happens, and that you are not alone. Even if we may not know you, we know that you're not alone. So having this conversation is very important. Finding a social support group that you can join. I mentioned earlier there's one called the Waiting Wombs Trust, and and they have offices in Nairobi, Kenya. They have a website, they have a Facebook page you can follow, you can join. I know they have webinars. I know they have couples that share one with another. It helps to journey with people along that journey, because it is a treacherous, painful, dark, quiet journey. The problem is you have to act okay even when you're dying inside. You see, if a normal mother, a mother who has given birth, loses a child that we have seen, everyone will gather around her and mourn with her and support her and comfort her. But you are losing a hope every month. This morning I bumped into someone's podcast, and they were saying how they've been waiting to have a child for almost 15 years now. And she was saying she has mastered and crammed all those, early pregnancy symptoms. So she'd feel bloated at night, and she'd go like, oh my God, this is it, this is it. She'd look at those apps that Dr. Nelly was talking about, which I think every woman has those apps. And if you don't have it, please don't get those apps. Those apps can be quite addictive. So she looks at the app and she says, oh my God, this is it. And she goes to the kitchen and she's feeling a bit nauseous. And by this time, her mind is now literally playing games with her. And her mind is causing what we'd call a psychosomatic reaction, where your brain is creating all these physical reactions that are imitating an early pregnancy. And she's so excited, and she's like, oh my God, I'm pregnant. It's finally here. The metallic taste, it's in my mouth. Oh yeah, my boobs are a bit sore. And she went on to explain how everything looked like she was pregnant until she was not. And there has to have a psychological funeral happening all over again. And she's had countless moments of the death of her hope. So that journey is treacherous. I wanted to just call her and tell her the bravery it takes for you to talk about this in public. I even wonder where you got that level of bravery and courage, because it is a painful, dark journey, but it has to be talked about. And I honor all those who've been brave enough to talk about it in public. I can only imagine what that looks like. But if you're not the kind that are able to talk about it in public, please join a support group. Please work with someone. I know even in the event that you do go for assisted reproductive health, such as IVF, that journey as well has a lot of difficult moments, a lot of moments where you think you're pregnant, and you're not, or maybe the egg doesn't take. I'm sure the doctors here will tell us that even with IVF, they don't always take the first time, and then after spending all that money and all those emotions and seeing this baby, you're told you're not pregnant. It never took, and then we have to do another cycle of trying to get pregnant. And all this is happening in a world where, I don't know how many of you are on social media, baby bumps are the order of the day. Everyone is posting, we're pregnant, we're pregnant, we're pregnant. I had one lady tell me in my office, Candy, people that she doesn't think in her head should be pregnant are pregnant. She and her husband have been trying in a good home. She was basically trying to say, have everything a child would need. Why am I not getting pregnant? Young girls, teenagers are getting pregnant left, right, and center. Why am I not getting pregnant? So all those conversations that you keep having in your head, where you see a lady in the street, she's literally begging for food and she's pregnant. Yet you have a pantry full of food and you cannot be pregnant. You're struggling to get pregnant. All those conversations that happen in your head every day, they need to be acknowledged. Those conversations need a place to be externalized, so that you can get support, so you can get just to be seen. I always say grief, loss, pain needs to be seen, acknowledged, and attended to. Otherwise, it'll turn you into someone you don't want to be. So support, support, support. That is where I'll stop.
Wonderful. Thank you so much those encouraging remarks, Candy. Indeed, these are remarks that all the listeners who are here and many other women and men who are affected need to hear. Support group and just knowing that you're no different from another woman. And thank you so much for just sharing even just those stories from people you have interacted with directly or indirectly. I see Hannah has finally been able to speak. Hannah, if you can hear me.
Yes, I can. Thank you very much for the second
Go ahead.
chance. And I agree with Dr. Nala what she's saying. It's always good to be able to speak to somebody, but sometimes there might not be any issues. I have been in a previous marriage. I could not conceive, but I was married at a very young age. It didn't work out. Got into the second marriage. I conceived immediately. I came from where I am and I came to Kenya, and then I wasn't feeling well. I'm thinking maybe it's typhoid, maybe it's this. I'm not able to eat. We went to get some tests, urine tests, and all that. I remember standing at the guy who's giving me the results of the lab, and then where your mind goes blunt, and the guy goes, "Yeah, it's congratulations," and I'm like, "What?" He says, "You're positive," and that I could not even understand. I could not even comprehend what positive was. I'm like, "What? What do you mean positive?" And I couldn't even know what positive and negative meant. And funny enough, my partner also had previous partner. He could not conceive either. So he's standing beside me, and I'm like, "No, I'll give you my." And he goes, "You're pregnant." The first word that came out of my mouth was, "I never get pregnant." I still can remember that vividly. I never do get pregnant. And I say, "No, uh, that must not be my urine. Try again, test it again." And it was really emotional. Anyways, to cut the long story short, we both went where we resided. I could not talk to him. I could not say anything. I was quiet. I went to bed. I woke up around midnight and I asked him, "What happened today? Did that? Was I told I was pregnant? Is this for real?" So that's how much toll it takes on a woman, and it's not easy. Either way, I got three daughters, but with gaps now, like, never took any contraception or anything. But for some reason, there's been gaps, either 2 years, either 5 years. The last one was a 9-year gap between my daughter and my last born. I never bothered to go to any doctors or get checked or anything, but it took 9 years. So sometimes things do happen, but it's always good to get checked. I didn't know I had endometriosis. I kept getting heavy periods, very painful ones, pain during whatever. And so I think most ladies do have some problems. They get some symptoms, they get some pains, but it becomes part of them. That condition became part of me. I thought, oh, okay, this is me with my period, with my cycle. This is how painful it is. So I just live with it, take painkillers, do this, warm water bottle, and all that. It reaches to a point where I had to be blood transfused, get some iron transfusion, and then that's when the doctor's like, "No, we have to know the cause problem of this." Then I explained, when I've got my periods, this is what happens. Um, I was sent to a gynae. But anyways, long story short, I got a I got a coil that would probably trick the mind of the thinking, because I'm not looking forward to have any kids now. So I did get coil put in, with hormones, so to balance that. But what I wanted to ask the doctor is, uh, having that condition, and I had cysts, I had fibroids, you name it, I had everything. But my main question was about the having the endometriosis. Can that cause a problem conceiving, or prolong, or make it difficult to conceive? Uh, that is my main question I wanted to ask. And a lot of women aware of the small conditions that might be blocking them, like having fibroids is painful, it's unbearable. yeah, endometriosis is worse. It's debilitating when you get the pain. So that's what I wanted to ask the doctor. Thank you.
Um, Thank you. Thank you for sharing your story. You've actually put a lot of things in one basket. So endometriosis, and I mentioned this right at the outset, 50% of women who present with infertility, who have endometriosis, their first presentation to the gynecologist is usually infertility. And why is this? Because we've made a huge mistake over generations and generations of normalizing period pain. Period pain from adolescence. You have period pain, you come home, you say, I have period pain, you're told now you're a woman. This is what it means to be a woman. You have heavy periods. Your mom tells you, I used to have heavy periods too. Oh, your cramps are really, really bad. And you're like, don't worry, it's teenage. You will grow out of it. And those are the early signs of endometriosis. So we then normalize it for the children, and as they grow into adults who now take over the responsibility of their own health in their 20s, they actually don't know that they should seek help. On average, research shows that it takes an average of 14 years for a woman to be given a diagnosis of endometriosis. This then describes exactly you, that you probably were the one on the higher end of the spectrum getting your diagnosis a lot later. But endometriosis is one of the commonest non-infectious reasons for tubal blockage, for infertility, for ovarian injury and damage. So it definitely can easily explain these delays that you had and the challenges that you had with conception. The other thing that will be fairly classical is also polycystic ovarian syndrome, which we've talked about, because over a woman's lifespan, the polycystic ovarian syndrome presentation will vary. So there are those who will actually struggle with fertility, not always full infertility, but definitely quite a spectrum around subfertility. And if this was the case for you in your initial conception, and you probably had a partner who may also have had some level of subfertility for one reason or the other, maybe a bit of a low sperm count, or maybe a higher number of abnormal sperms as compared to what is should be normal expectation, then you can see how together it may have been difficult to have children. And then you move into a new relationship, and then you have a partner who doesn't have issues. And probably at that point in your life, your polycystic ovarian syndrome is behaving very well. And boom, there's your chance, unexpected, unplanned, and there it is. I actually currently have one of my moms who's going through antenatal clinic. And when they first came to see me, they already knew their diagnosis. And she's like, I have tried everything. I am tired. And so, for me, I was like, you know all the treatments. My job is to educate you what polycystic ovarian syndrome means and what your expectations should look like. By the time we're done with that conversation, she said, let me take a break. I'm going to take 6 months off. I'm not trying to get pregnant. I will come back in 6 months, and then we can see how we're taking it to the next level. And 4 months later, they call me and she is completely pregnant. Nauseous and throwing up all over the house, and she just cannot believe it. So it can happen. And there are many women with polycystic ovarian syndrome who walk around and have 5 babies, and they never, ever have to deal with infertility. And then when they are maybe a little older and they gain 20 kilos, and boom, the symptoms come crawling out of the woodworks, because weight has a huge impact on the symptomatology of infertility. So you can imagine if this woman who had her children from her early 20s has 5 children by the time she's 35, and now gaining weight at 38, if she was starting to have children at 38 with all the symptoms, with the weight gain, the obesity, the disruptions to her menses, this was definitely going to be now dealing with an issue of infertility and subfertility. So as we have emphasized since we began to have this conversation, it's important to put a diagnosis to it. Infertility is literally not a diagnosis. It's actually a symptom. And the diagnosis will arise out of knowing the cause of that infertility, so that then you're able to focus your treatment based on what is the problem in the first place. So you make a lot of sense. Fibroids would rarely be a cause of infertility unless they are located, where they are located could be a problem. We have fibroids that can grow into the cavity of the uterus, what we call submucous fibroids. Those can have issues with implantation, that your egg does get fertilized, but when it arrives in the womb, because of this foreign object sitting there, it may become a problem for the newly formed embryo to implant in the womb, and essentially you end up having a miscarriage even before you knew you were pregnant. The second one is when they are located at the ends of the uterus where the tubes join the actual uterus, because then they become a physical obstruction to the tube. Your tube is nice and patent, but because of where the fibroid is located, then it becomes a physical barrier. And so surgery becomes necessary to relieve that barrier, to open up the tube and allow for the egg and the sperm to be able to meet. So all of these are various causes, and these are some of the reasons for secondary infertility, that you may start out well, but along the way, these things catch up with you. The issue with endometriosis and early diagnosis is because this is a progressive disease. It's never going to stop until you reach menopause. And the problem with endometriosis is that it causes continued inflammation in the pelvis. There's no organ that likes continued inflammation. Every time there's inflammation, you're going to form abnormal tissue, scar tissue, and all these scars are what we call scars inside of the abdomen are different from the scars we see on our skin. So those ones in there are what we call adhesions, and they cause matting of organs. They get stuck together, they get distorted, they are in the wrong positions, and all these things actually contribute to infertility. So you want to have an early diagnosis of this condition. You want to start treating it early to minimize that progression. You want to start having an early conversation with a woman about how infertility can become a challenge in the future. And so they may want to consider having children a little earlier in life, even if that was not necessarily in their plan. So these are all-rounded conversations of wholesome management of your patient's condition to ensure that infertility doesn't become one of the issues 10, 15 years down the line. I hope I have addressed your questions.
Yes, thank you very much. Even though I still don't understand the 9 years gap, could that be because of the endometriosis or not? I'm not sure.
It's possible. It is possible. It's also possible, as I said, polycystic ovarian syndrome, circumstances changed. I've had a patient who had her first two children, and then 12 years later, she's trying to conceive, and she's like, what's wrong? And everything was perfectly fine. But when we worked with her 12 years ago, when she was having kids, she weighed 63 kilos. Now she's 90 kilos. And she has a diagnosis of polycystic ovarian syndrome. I told her, why don't you try and just lose 10 kilos and then we can see what we can do. She came back pregnant. We do not, I don't even remember whether we met the target weight loss, but she definitely came back pregnant. And for her, that swap in weight, which she may not have thought about, because it's not weight that has come overnight, it's weight that has been creeping up over so many years that you even stop paying attention to the fact that your size drastically changed. And the reverse happens. Others actually you go and have a patient who's newly diagnosed with diabetes, and they're like, wow, lifestyle change, or just for whatever reason, they become a lot more aware and they lose weight, or they even go through a difficult experience, which makes them automatically lose weight. And this alters their fertility. And so I say fertility is not static in women. Even for those who don't have infertility issues, it's never quite static. So any contribution to this multitude of reasons why it may be a challenge to conceive at any point in life can actually result in challenges conceiving in extended periods in between children.
Right, I see, Hannah, you
Much
still have a
appreciated.
question.
Thank you very much. Thank you.
Thank you, Hannah, for your questions. Dr. Nelly, thank you so much. You're amazing. As we come to nearing the end of our conversation today, I'm so happy we've had this conversation. It's much needed. Dr. Nelly, for those who probably have been diagnosed with infertility, what will be your last remarks? Is there hope? Is there a chance of, conceiving?
I think for me, infertility is something you want to start seeking treatment as soon as yesterday. For men, they may have leeway, But for women, age is real. Remember the conversation I had about the female fertility period. As your 300,000 eggs are dwindling down, whatever is left behind is poorer quality. It's probably not the best choice. The best ones have already ovulated first. We always say, even for normal healthy women without fertility issues, the best age of conception is actually 20 to 29. Thereafter, we're going to have struggles because there is a sudden rise, especially after the age of 35, of fertility issues, a sudden decline in our ability to not just ovulate, but the quality of the eggs we ovulate is going to start deteriorating. So imagine adding in an infertility problem. Don't hesitate. We say maximum 1 year, healthy couple trying to have babies, please seek help. If you're above the age of 35, no, you don't have the luxury of 1 year. We say 6 months. If in 6 months you haven't conceived, please seek help. Start as early as possible. What happens to most of our clients is that you don't like the diagnosis you've been given. Then you spend another 5 years seeking a second opinion, here, there, everywhere, specialist to specialist, moving to India, coming back, going outside of medical conventional medicine and trying also other alternatives. What you don't realize is that the clock is ticking. The older you get, even with our assisted reproductive technology, the lower the chances of success for those interventions. We want to intervene in the youngest possible age you can. It gives you the best outcome. So for couples who are struggling with infertility, please don't waste time. Give us something to work with. Come as early as you possibly can.
Thank you, Dr. Nelly. And even before I go to Kendi for a final remark, I see Hannah still has a question. Hannah, go ahead. Hannah, can you hear me?
No,
All
I
right.
was just agreeing with the doctor. I was just clapping for her remarks. Yeah, absolutely.
All right, thank you. Dr. Nelly, just when you now speak to couples who have not had such a diagnosis, how can someone take care of themselves? Is there a way to take care of yourself to, prevent infertility? Just your final remarks as a recap of what we've been talking about today.
What I can say is we all must remember we only get one body in this lifespan. Take care of it. It's the most prized possession you've got. So if you cannot drive your car carelessly and have it dented and banged and dented everywhere and lights not working, why would you do the same to your body? Take care of it. And taking care of it is an all-round business. It's not just thinking about fertility. It's wanting to have a healthy heart because it allows you to have the pleasure of sex into a ripe old age. It's ensuring that you do not get obese to prevent chronic illnesses, because diseases like diabetes will definitely directly impact on fertility. It is also ensuring that you're not unduly putting yourself in harm's way with sexually transmitted infections, with genital tract infections that can be avoided, that will become a nightmare just a decade down the line. So all I can say is that whether you're coupled now or you're not coupled, whatever age you are, it's never too late to start to taking care of yourself. Start now. Start now. You'd best have started yesterday, but we are here today, so start today.
Wonderful comment.
Sorry, doctor. Yeah, I wanted to ask also if it's advisable to have the babies early, as Dr. Kenny was saying, because as a woman, having a child at late age, also you end up having some other conditions while you're pregnant. You might conceive, but then you might end up having other issues like preeclampsia, and maybe after birth you might still end up having hypertensive that will not go away, or diabetes, whatever. So I think there's a lot of complications at having babies at quite late stage. So maybe they should advise for women who are looking into careers, saying, "Oh, I still got time. Let me get along with my career. I can do this later." I mean, the clock is ticking, and there's complication ahead of you. So it's worth considering that too.
there? Dr. Nelly, can you hear me?
I can. Sorry, Leah. I missed you there. I don't know if it was my network. Just repeat what you asked.
So basically, what Hannah, if I'm getting her right, what she's saying is maybe you can give some, words of wisdom to the young women, and of course probably the young men who may feel they have a lot of time ahead of them in regards to getting children.
Hannah's absolutely right. And this is something that as practitioners, as reproductive health people, we're struggling with, that the world is changing so much that the balance between desire to have children vis-a-vis desire to also pursue other achievements in life can become a bit of an issue. We are having to shift our mindset to understand that our patients will not do what we say, they will do what we want. So we're stocking up to support them when they decide that their first baby is going to come at 48. So Hannah is so right in the sense that, yes, you will have those babies at that age because technology and medication and all these improvements in healthcare can allow you to. However, you can bet it's going to cost you more than 10 times more to have that baby at that age. It is, pregnancy is a huge stress to the female body. And I can tell you, I see this every day. My average first time mother now in my private practice is 36, 37, 38 years old. Right now, I think the current oldest mom in care who is pregnant and for the first time is 43. So this is a reality. This is a reality that we're having to live with. That I understand. You're going to think about high risk of congenital abnormalities in your own baby. Down syndrome risk goes up with age, and all other genetic issues that may arise. What Hannah is saying, hypertension, diabetes, these are conditions you can develop even before this pregnancy comes, and balancing the pregnancy with these conditions is a nightmare. But they are also more likely to be triggered by being pregnant, and they may not resolve after pregnancy. They will be what welcomed them to stay for the rest of your life. Physically, just the way the body handles the pregnancy, the back pains, the pelvic pressures, the nerve, pressures, and all these complications. It's a much more difficult, much more painful pregnancy to carry at an older age. So I don't think we're having these conversations enough. And so, yes, you focused on career, you've hit the apex, you're making all the money, you're going to give me a lot of it to keep your pregnancy safe and keep you alive through the pregnancy. You want to think about that bargain and whether it makes sense for you. So, I always tell women, no one's telling you to have children today. What you want to do is think about whether you want to have children or not. And if you truly want to have children, these are the realities. Go away with information so that you make an informed choice about when you want to have your children. So we've had this pressure through the years from girls go to school, girls must be educated, girls must climb the corporate ladder, we must compete with men, we must do everything. But remember, the man's clock is not ticking as fast as the woman's clock. So you always must step back and ask yourself, apart from all these achievements that I'm pursuing, where do children fall in this space? And if you opt out, we support you. But if you opt in, we want you to know what this is going to look like if you have them at 20, at 30, at 40, and then you make a decision on what you want to do.
Thank you, Dr. Nelly. Wonderful, wonderful comments. There's so much wisdom and knowledge there. Thank you, Dr. Nelly. Kendi, I'm so happy that I had you throughout this conversation. Maybe you can just give us your final comments, remarks to our listeners in regards to today's topic.
Yeah, thank you for this wonderful conversation. I've learned so much. And I'll just say, as you take care of your body, as Dr. has said, take care of your mind, take care of your emotions, take care of your relationships. Fertility is, as we've learned today, a very complex process. It's physiological, it's physical, it's also social and psychological. All right. So be careful the relationships you get into. Avoid traumatic relationships. Avoid hostile, abusive relationships. Avoid relationships that will tear you down. All right. Your fertility is something to be celebrated and to be pursued in hopefully a mutually beneficial relationship. So be careful the relationships you go into from an early age and the relationship you're willing to stay in. Take care of your mind in terms of how much stress and pressure you're piling up on your body. Like Dr. said, we only have one body, but even worse, we have one brain, and this brain is responsible for your cognitive functions, physiological functions, physical functions. You have one amazing, amazing brain. Please do take very, very good care of it. And if you're a person of faith like me, trust God for your children and pray about it, because there's an element where science reaches its end. And we've heard about miracle babies left, right, and center. Not to mean that we should gamble with our the season of our lives just because miracle babies happen, but it is to say that maybe you are at an age where you have gone past the 35-year mark, not by your own choices. Maybe you're at an age where you're in your late 30s, early 40s, and this is when you're in a steady relationship, because many women do want to have children in a steady relationships, in a steady home, in a steady relationship. Pursue the best healthcare money can buy. If you're a person of faith, engage your faith. Again, take care of your physical body and take care of your emotions. Do your part as much as possible, wherever it is that life finds you. But like Datari has said, let's take good care of the seasons and the opportunities that we have. But again, for many women, it's really not their choice to be conceiving in their 40s. Many of them, it's just, the hand that life has dealt them. But for the younger women, take advantage of the season you're in. It's wonderful to be young and energetic. Take care of your uterus, take care of your eggs, take care of your health. Your youth is priceless. Those are my final remarks.
Wonderful comments there from you, Kendi Ashitiva. Thank you so much for being part of this conversation. Dr. Nelly Bosire, Kendi Ashitiva, and of course we had Dr. Keegan and Dr. Kerika, who also left earlier on, but we are so happy that you are here to give us all the knowledge and wisdom that we've been able to get as regards today's discussion. And of course, many thanks to all our listeners and to everyone who has contributed, whether in asking questions or in just making a comment. We are happy that you are part of this conversation. This is a conversation that we can continue even beyond this Twitter space today. So let's keep talking about these real issues that are affecting real people. Thank you once again. My name is Leanne Garrett. This is Mwanzo TV Spaces. Remember, we are always here every Wednesday from 7 p.m. to 9 p.m. talking about issues affecting people across the continent. Thank you once again and see you next week on Wednesday, 7 p.m. for yet another interesting topic that is beneficial to you and I. Have a good night and God bless.